Hi, I'm Audra Burns from Dartmouth-Hitchcock, and welcome to the second session of our relaunch of our popular roundtable series, Heads Up, Coping Through COVID-19. Today's segment will focus on understanding the COVID-19 vaccine. I'm pleased to introduce our panel of experts today. Joining me is Dr. Aalok Khole, epidemiologist and infectious disease physician at Cheshire Medical Center.
Thanks so much, Audra. Thank you for having me.
Great to have you here. Dr. Staci Kraft, Vice President of Population Health at Dartmouth-Hitchcock Health.
Great to be here.
And Dr. Staci Hermann, Chief Pharmacy Officer at Dartmouth-Hitchcock Health.
Thanks, Audra. Happy to be here today.
I'm so glad to have all three of you on this important conversation. So Dr. Hermann, some people are concerned about the safety and efficacy of this COVID-19 vaccine, given how quickly it was created and approved. Can you explain the development and approval process for a vaccine?
Absolutely. Vaccines, like any other drug that comes to market, follow a very stringent pathway from development to production and availability for the general public. Prior to any type of studies being done in human subjects, there is a lot of development work, both in the lab and through animal studies, really looking at safety data and whether the drug will even be effective. Once that has been proven, the pharmaceutical companies will then enter into what they call human subject trials. These generally have 3 phases. The first phase is really focused, again, on safety, so making sure the drug is safe to be used in humans. The second phase generally focuses on efficacy. And then the third study phase is generally focusing on the broader population and really understanding the impact more globally. Even these vaccines, moving through those 3 phases, happened very quickly. They did go through all 3 phases. In addition, all studies have what they call an institutional review board. This is an independent board that assesses the study data for safety and efficacy throughout the entire trial. And if anything were to happen, this independent board can stop the study midway and say that the study is no longer safe for it to be used in humans. We actually saw a pause in the AstraZeneca trial this year because there was questions about safety concerns. This independent review board paused it, reviewed the data, and then allowed the study to continue because they determined the incident in question was not related to the vaccine at all. So we did move through all 3 phases, and so it's been proven to be safe and efficacious and available in the general public. The other important thing to note is even though we go through all 3 phases, the FDA sometimes decides that drugs, while moving through these 3 phases, needs to come to market sooner than before the study is actually finished because the evidence suggests there's much more benefit to having the drug available to the general public. And this is the case with these 2 vaccines. It actually caused more harm not having the vaccines in the market than bringing them through faster. Again, they still are reviewing data, still showing they're both safe and effective and ready to be used in the general public.
Thank you. That's wonderful. It's so great to hear from an expert like you to reassure the public that even though it went fast, there's reasons behind it and that process were followed. So thank you so much for sharing that. And hopefully it reassures people out there who are watching. So Dr. Khole, why is it important for people to receive the COVID vaccine when they are able to, following the CDC and state guidelines?
That's a great question, Audra. I think the easy way of looking at it is the benefits sort of twofold. So when you look at it from an individual perspective, all these trials have shown significant efficacy with respect to preventing COVID-19 in those who get vaccinated. It definitely reduces the incidence of severe disease, so hence would prevent you from getting hospitalized even if you was to get mild disease. And at the same time, that prevents morbidity and mortality associated with the illness. If you look at it from a community's perspective, vaccination is a key instrument that we have in order to disrupt the chain of transmission. So which would mean we can stop the virus in its tracks from spreading from person to person. Thereafter, the benefits would include sort of allowing our healthcare institutions to appropriately provide care for those who really need to. So you don't really have to triage care. It allows you to sort of function at a normal level. So, I think the key is to vaccinate as many individuals as fast as we can if we want to get ahead of this virus. It's definitely our ticket to a journey out of this pandemic, and I would urge anyone and everyone who gets a chance to get on board.
I like that. We can all get on board to what you just said about disrupt the chain of transmission. We can all do our part. That's excellent. Dr. Kraft, people are wondering if they still need to wear a mask and physically distance after receiving both of the vaccines. What's your expert advice on this?
Yes, thank you. It is really important because all of us want to return to the life that we had before the pandemic, but it's going to be very important that we continue to wear masks and to practice other public health measures such as remaining physically distanced, avoiding crowds, good hand hygiene, and being very careful in travel and avoiding travel to areas with high community transmission. The reasoning behind that is that the vaccine is just one measure in the entire toolkit of how do we decrease and break this chain of transmission. The vaccine is for the two that are on the market that Staci talked about, the Pfizer vaccine and the Moderna vaccine, which are the two that we're using now. They're about 95% effective, which is great. And they're very effective at preventing severe disease, like Aalok was talking about, severe disease or hospitalization. But 95% effective means maybe 5 out of 100 could still become infected with COVID-19. And even if you got COVID-19 after you've been fully vaccinated, it will probably be very mild. In fact, more than likely asymptomatic or so mild that you don't even know that you're sick. You may inadvertently, by going out into the community or going to other public places, you may inadvertently spread that virus. Not intentionally, you didn't know you were sick, but you could be spreading virus. So we need everyone to wear their masks, all of us, regardless of your vaccine status, to keep others safe, as well as to keep yourself safe. And there's a mantra that we're beginning to use a lot, that no one is safe until everyone is safe. That will be true for us in our communities, our schools, where we work. It's also going to be true for us in the whole world. We're going to work very hard to get everyone vaccinated here in the United States. That's what we're all working on. But in addition, we've got to be thinking about other countries and other populations, because no one is safe until everyone is safe. So get vaccinated, but continue those good public health measures until we reach that herd immunity.
Yep, that's a good toolkit that we have for making sure that we continue to do those precautions. So Dr. Hermann, people who have already contracted and recovered from COVID-19, do they need to get the vaccine, or are they already immune from the virus?
That's a great question, Audra. The CDC is recommending that everybody get their vaccination and get vaccinated. We know even pre the availability of the vaccines that there was reinfection happening, and we were seeing this across the country. Layered on top of that, now we have all the variants that are starting to pop up. And so we are also starting to see reinfection rates with those variants. And so it's incredibly important that whether you've had COVID in the past or perhaps you've received a monoclonal antibody, you should still get the vaccine. There are trials underway understanding how these vaccines work with these new mutations. And so all signs are pointing to the vaccine being protective against the mutation. So again, everybody should be looking towards getting vaccinated as soon as possible.
And Dr. Khole, Dr. Kraft had mentioned the word herd immunity earlier, and I think we've all kind of heard that buzzword on the news lately. So can you explain to us what herd immunity is and why it's important?
Absolutely. It's the question of the hour, day, week, whatever you may call it. Everyone's excited to know what that magic number is. I think as Sally put it well, right? No one is safe until everyone is safe. So what exactly is herd immunity? So when you have significant portions of the population immune to a particular infectious disease, either by way of being infected and recovering from it, or by vaccination, whatever the case may be, when you attain that specific number, you're sort of disrupting the chain of transmission, preventing the disease or lessening the likelihood of the disease spreading from one person to the other. At that point, you're not only protecting the community as a whole, but you're also potentially protecting those individuals who are not eligible for vaccination, which we do know these vaccines have not been trialed in children, kids, and certain other special populations. But it is our responsibility to protect anyone and everyone. If I was asked to sort of pin my thoughts on a particular number, it's extremely difficult to do because that's ever changing with respect to how the virus behaves, the dynamics. And now, as Staci mentioned, we have the new mutant strains coming into the picture that we are still learning about. If you look at the data that's being talked about, that number fluctuates anywhere between 70% to 90%. However, that number depends on so many different things. If we are able to vaccinate a large number of individuals, ahead of time, thereby preventing these strains from gaining stronghold in the community, that number goes down. If the vaccine strains, which are mutant, infect more number of individuals, and we don't know whether folks are susceptible to reinfection with these strains as of now in a certain time period, then the likelihood is that number is going to be a little larger. I think rather than concentrating on that number, it's key to, it's not going to be one point in time where everyone says, great, we're done with COVID and we're moving on. I think that's not going to happen. We're all hopeful that we come to a point where we can start phasing back things like everything with COVID. It's always been a stepwise approach. We are keeping a close eye on how many are truly infected and recovered by way of sero surveys. We're looking at how many people are vaccinated, what's the duration of immunity, what are the vaccine's efficacy against these mutant strains, and all these factors taken into consideration can then help us come up with a plan saying, okay, is it late summer, early fall, sooner than that, depends on how many more vaccines come into the market and how soon we get people immunized. So it's an ever moving target. We're hopeful. And I know everyone's facing COVID fatigue, but this is not the time to let our guards down. We still have to keep doing what we're doing if we want to get out of this at some point.
Great advice, to remain diligent absolutely is important and crucial at this time. And all three of you touched upon, the importance of getting vaccine and advocating for everyone to get it. So Dr. Kraft, let's talk briefly about, the rollout of the vaccine and why is it being distributed in phases and how can people learn when it's going to be their time?
Yeah, so unfortunately, our supply of vaccine is much less than the population. And we had to make decisions about who should get vaccinated first. And then as vaccine supplies become more and more plentiful, then we can go faster and faster and faster on vaccinations. So with the supply being restricted as it is, decision makers nationally and decision makers at the state levels have decided we're going to prioritize and identify those populations where we want to do our best to get them vaccinated to decrease severe disease and decrease death in our populations. So each state makes a decision about who's going to get vaccinated. Many of us started off all on the same level, recommending that healthcare employees, staff, physicians, nurses, everyone who's working in healthcare get vaccinated right up front. Why? Because we need the people to be able to be in the hospitals and the clinics to take care of us if we do get sick. Most other states have also prioritized people who live in long-term care facilities or nursing homes. We know nationally about 40% of all the deaths in the United States have occurred in nursing homes. And this is because they're living in congregate, close quarters, and they're older. We know that elderly are more susceptible, are more likely to die if they do get COVID-19 disease. And they often have many of the complications, chronic conditions that also increase your risk of death. So long-term care facilities, both staff and the residents and healthcare providers have been on that first list of let's get those folks vaccinated in order to blunt the severe disease and the death from COVID-19. And then what you're going to see after that is there's some variation from state to state. In the state of New Hampshire, we have this state guidance from the Department of Health and Human Services said we want to start to vaccinate people who are 65 years of age or older. We want to vaccinate people who are medically vulnerable. In other words, they have a number of conditions that increase their risk of getting very severe COVID-19 disease. And those conditions have been outlined by the Center for Disease Control, the CDC. And you can find that list. We have a link to it on our Dartmouth-Hitchcock COVID-19 website, and you can actually examine that list of conditions. They've also identified residents and staff in residential facilities for persons with intellectual and developmental disabilities, corrections officers, and any first responders and healthcare workers who didn't get vaccinated before. I failed to mention that the first responders were also in that very first phase 1A allocation. After that, there'll be other phases, phase 2, phase 3, and as the vaccine supply become more and more plentiful, we'll be able to really liberalize who's going to be able to be eligible for vaccines. At the end of the day, we want everyone to get vaccinated. And in the meantime, wear your mask, wash your hands, stay physically distanced, and avoid large crowds. And I think we'll get there if we can follow those practices.
Absolutely, we will get there if we all do that. And Dr. Hermann, you touched upon this briefly earlier, but I want to talk a little bit more about the COVID variant that everyone's hearing about, this new strain. So can you kind of just briefly touch upon what it is, what we're hearing about, what a new variant might mean, and are these vaccines currently going to be able to help protect us?
Absolutely. There's actually 3 different mutations that I'm aware of. One from the UK, which is the one I think most people are talking about, and the one that's most prevalent in the US right now, in addition to the COVID strain that started in the US. But we also have the South African variant, and then there's another variant out of Brazil. And so what we do know is all of the pharma manufacturers are looking at all of these different strains to see whether their vaccines are protective against them. There was a recent article in the New England Journal of Medicine looking at both Pfizer and Moderna. Both are looking to be protective against the UK, but there is some question about whether they're as protective against the South African variant. What this means is I would anticipate that we will likely need boosters in the near future to help keep that protection level up because the virus is mutating so quickly. And so as it mutates, the pharma manufacturers are then making sure that they are keeping up with those mutations to help provide that protection. I do not see this as anything atypical. If you think about how our flu vaccines actually work, pharma is also doing this every year with the flu vaccine. So the flu virus itself mutates every year, and we're trying to stay ahead of it with all of our flu vaccinations. And so I suspect COVID will likely be in the same boat where we're trying to stay one step ahead of how the COVID virus is going to be mutating in the future.
Thank you for that. And thank you to all 3 of you for joining me today. I really appreciate your time on this important topic.
Great. Thanks for having us.
Thank you.
Thanks.